Hi, I'm Dr. Patrick Harlan, and I'm one of the veterinarians here at Imperial Highway Animal Clinic, and I'm going to talk with you today about our recommended feline vaccination protocol. First, I want to talk to you about why we do vaccines. Essentially, vaccinations are meant to create and boost an immune response within an individual so that they can better defend themselves against a disease they would otherwise have to contract and experience illness. Many of the diseases we recommend vaccination for can be fatal to your pet, especially if contracted early in life. Some can even be transmitted to us humans, and we call this zoonosis. It is important to stimulate the immune system early in life to continue protection, just as the maternal antibodies passed along through the milk through nursing begins to wear off. Vaccines are not only helpful for individual protection, but also to create what we call herd immunity. This is a process by which we create a majority of immune individuals within a population. Through vaccination, we can control transmission of disease from a sick individual to a susceptible individual. The stronger the herd immunity, the less prevalent the disease is in the population. First, I'm going to talk with you about the FBR CP vaccine. This is a 3-in-1 vaccine that includes feline viral rhinotracheitis or feline herpes virus. This causes an upper respiratory infection in cats that can lead to eye and nose discharge, fever, sneezing, and even conjunctivitis. It can also progress down to the lower airway and cause a life-threatening bronchopneumonia. Second in this vaccine is the feline calicivirus, which is the second leading cause of upper respiratory infections in our cats. Symptoms are similar to the herpes virus infection, in addition to formation of mouth ulcers and even alternating leg lamenesses. Some virulent strains can even cause life-threatening pneumonia. The third in this vaccine is the feline panleukopenia distemper virus, or the feline Parvo virus. Not only can this cause an upper respiratory infection in cats, but it can also cause severe digestive distress and neurologic disease in our kittens. Symptoms can range from fever, vomiting, diarrhea, to an abnormal gait and imbalance. Our hospital recommendations for this vaccine are to start at 6 to 8 weeks of age, then booster every 3 to 4 weeks until 16 weeks of age, or at least 3 rounds of the vaccine. After the kitten immunizations are completed, we booster in 1 year and then every 3 years thereafter. Another vaccine that we recommend vaccination for is the FELV or feline leukemia virus. Infection with this virus can cause immune system suppression and cancer formation. This is known as the friendly cat disease, and is transmitted commonly through mutual grooming between cats or sharing food, water bowls, and litter boxes. Once contracted, there is a lifelong infection in most cases, but this can regress to a minimally symptomatic state that can still offer quality of life. However, they will be susceptible to serious infections and cancer formation. FELV positive cats should preferably be indoors and in single cat households. Our recommendation is to start this vaccine at 8 weeks of age, and then we booster 2 to 4 weeks, and then once yearly thereafter. Next, we have the FIV or feline immunodeficiency virus. This is the equivalent of HIV in our cats. This virus attacks the immune system. We refer to it as the aggressive cat disease, as it is transmitted most commonly through bite wounds between cats. Infected cats will have a persistent lifelong infection and are also highly susceptible to secondary infections, which can be fatal. FIV positive cats should be indoors only and in single cat households preferably. Fortunately, there is no risk of transmission to humans or our dogs. However, at this time we currently do not offer vaccination for this virus. Lastly, rabies virus is a viral infection that most people in North America have at least heard of, even though it may not be as prevalent here as it is in other countries. All mammals in the world are susceptible to this fatal disease. There is no treatment or cure for this disease, so the best thing we can do is vaccinate to prepare the animal's own immune system. Our hospital protocol and county regulation mandates that this vaccine be given no sooner than 16 weeks of age. Then we booster in 1 year and then every 3 years thereafter. I just want to say thank you for watching this video, and we realize that you have many options when it comes to your pet's healthcare, and we're glad that you trust us with your pet's safety and healthcare.